Welcome to the Gerontological Society of America's Momentum Discussion, where we explore groundbreaking topics in the field of aging.
Welcome to this GSA Momentum Discussion Podcast episode titled Dementia Diagnosis to 1 Year Out, Perspectives of People Living with Dementia. The second in a series of 3 podcast episodes developed by the Gerontological Society of America, or GSA, in collaboration with the National Council of Dementia Minds, the first national 501c3 organization founded and governed by people living with dementia. We're grateful to Eisai, Genentech, Lilly, and Otsuka for their support of the GSA Care Toolkit for Brain Health in this 3-part podcast series. My name is Jen Pettis, and I'm the Director of Strategic Alliances at the Gerontological Society of America, and I'm pleased to serve as the host for today's Momentum discussion. Today, we're diving into a critical but often overlooked part of the dementia journey, the first year after diagnosis. That time can be filled with confusion, grief, questions, and decisions, but also growth, clarity, and community. Joining me today are 3 individuals who know this firsthand. Seth Stern, an OB/GYN physician who concluded his practice after 37 years of dedicated service to his patients, who was diagnosed with frontotemporal degeneration in 2022. We're also joined by Miriam Owens, who was diagnosed with dementia with Lewy bodies in December of 2022, and has since become an advocate for improving the experience for others in the early stages of dementia. And finally, we're joined by Phyllis Cole, who was diagnosed with early vascular dementia about a year ago and is extremely optimistic about new findings around causative factors for dementia and new approaches to treatment. Seth, Miriam, and Phyllis, welcome, and thank you for joining me today.
Good to be here. Thanks
for having us.
Thank you very much.
Seth, let's start with you. Can you take us back to that moment that you received your diagnosis, sharing a bit about how that was delivered and what you were told or not told?
Essentially, in reaching my diagnosis, it took about 5 years in which I underwent significant testing over the years, and I couldn't really get a diagnosis. And then finally, in 2021, they did a PET MRI and they found significant changes on it. I saw some specialists. And it was confirmed that I had FTD. Regarding being told that I have FTD, and again, I had seen the PET MRI report before I was told, but the physician who ordered the test told me this is what you have. You have FTD, frontotemporal degeneration. You need to be seen by a specialist and try to enjoy the rest of your life. And this was I was told over the phone, not in person.
And so that it sounds like you were seeing that specialist, but then no additional follow-up with that the person who delivered the diagnosis.
Yeah, I didn't have additional follow-up with the primary. I saw nationally known FTD specialists at NYU and in Columbia and New York City. And also, I underwent repeat neuroimaging with an advanced PET MRI machine with someone who specialized and has received multiple awards in the diagnosis of FTD.
Okay, thanks. So, Miriam, I'll turn to you now. When you left your doctor's office after getting your diagnosis, what did the following days and weeks feel like? And what guidance were you given to help navigate those next few days and next few steps?
I was accurately diagnosed at my very first visit with my neurologist. Unfortunately, I did not receive any guidance whatsoever. And so, to be honest, the way that the diagnosis was delivered to me was pretty nonchalant. And at that time, I had very limited knowledge of dementia. So I guess I assumed that it wasn't that big a deal. The doctor did not seem unnerved or upset. He didn't give me any guidance. So I left the office just thinking, okay, there's a name to this and I'll be fine. I'll adapt or maybe it'll even go away. I don't know. But I did my own research in the weeks that followed and came to realize that this indeed was life-changing and that I would have to pivot and adapt to the new diagnosis and for years going forward.
And Phyllis, how about you? Can you tell me a little bit about how the doctor shared your dementia diagnosis and how they prepared you for that first year following?
Like some people I know, several people, there was more than one diagnosis. My very first one was, I was told I'd have MCI 7 years ago. really nothing followed that. To me, it wasn't a big deal. It was normal, what people experience. My second one was the one that I'm counting about a year ago. And it was, I went to my primary and said, my MCI is a lot worse. Here's what's going on. He said, unfortunately, there's not any good neurologist that I would recommend you to, but there is a good neuropsychiatrist, I think she was. And so I went to see her, and she did a lot of the testing with the brain scan and all kinds of things. Told me that while we were waiting for all of that, she treated me for anxiety, which was a joke because I won't say I never had a moment, because I've had a moment, especially since my dementia kicked in. But as far as my day-to-day, so I'd come to an appointment and the nurse would say, what are you even here for? Everything's no. So that was a bust. I did talk her into something. I did some biofeedback for about 3 or 4 months, and that was interesting, very interesting. I learned that I'm operating on delta waves all the time, and I have a real low blood flow situation. But it didn't seem to help. So after about 3 or 4 months, I quit and started doing my own research and led me where I am today. So that's just that first year. I will say that when she actually read the scans to me and told me I have early dementia, probably vascular in nature, she said, there's nothing that can be done. It's probably time for you to find an elderly lawyer and get your affairs in order. So that's what I was told.
Okay. Unfortunately, we hear that all too often, that same sentiment. Yeah. Seth, what, if any, resources were presented to you at the time of your diagnosis?
One of the centers in New York had asked me to participate in one of their research studies, but otherwise, no real direction or anything. Supposedly, social work is supposed to reach out, and that didn't occur. Basically, I just did research on the internet under dementia. I did fall into a group that was excellent called National Council of Dementia Minds. They're very supportive, instructive. And then having the diagnosis, looking up FTD, I came across the Association for FTD. And that has also been very supportive and educational. Being able to speak and see people that have your condition is reassuring. But otherwise, nobody hand-fed me or where to go, what to do, what to think.
So I see both Miriam and Phyllis in agreement on nodding their heads a bit, Seth, as you're talking. Miriam, as you listen to Seth's reflections, what information do you wish you had had? So what information or guidance do you feel was missing for you during that year? What would you have liked to receive for help?
Honestly, first and foremost, like Seth, I didn't receive any guidance or direction. What would have been nice to get at that point was information about the diagnosis, websites, written material, resources like support groups, social workers. Ideally, a care manager from the outset would have been very helpful. I think the assumption is that folks in the early stages of dementia or with younger onset dementia don't need that level of support early on, because stereotypically a person with dementia is in a corner and not aware of what's going on. And I think people make the mistake of thinking that from the outset, there is little that we need and little that we can offer. So it would have been nice to have those resources and also just some semblance of community and acceptance, a space in the community that said, hey, we see you and we know you're still capable of so much. Here's where you fit in. So I think the big C's, I have 3 big C's, and capable is first on my list. Dementia does take away a lot, but there's still so much we can do, so much that we feel, so much that we need. We're still people, the same people. So it'd have been helpful to have that from the outset.
Okay. And if I could ask you a follow-up to that, when you talk about a care navigator, care manager, what would be the 1 or 2 things that person could do right off the bat that would help that person who receives that new diagnosis?
Somebody said getting an elder care attorney, but not just the legal support, emotional support, spiritual support, that's what's needed and desired. Somebody to coordinate care for me as a whole person.
So really helping with connections and getting
connections.
Yeah.
Yes.
Okay.
Yes,
Okay.
that would
That's
have been
more.
very helpful.
Phyllis, what types of supports and services did you use during that first year? And how well did they meet your needs? What would have made them meet your needs better?
Just like Miriam and Seth both have said, I had to go find my own resources. For me, the one that has made the biggest difference is it was a book called The End of Alzheimer's Program by Dale E. Bredesen, Dr. Dale E. Bredesen. I dug into everything. I read that book cover to cover by audiobooks. I don't read anything hard copy anymore. And it just clicked with me. He has a complete protocol with 7 kind of pillars. And the first one was diet and exercise. So I jumped on those and followed the diet plan he suggested and the exercise kind of ideas that he suggested. And while I was doing that, I was also looking for a provider because I needed a functional medicine type doctor to follow his protocol, because that is the approach he advocates. Because the idea that he talks about is it's not just one thing, it's hundreds of things that need to be addressed. He calls them different insults. And in order to find out which insults were happening with me, we needed to do a lot of testing. So I needed a doctor to walk me through that. And luckily, I found one that is certified by Dr. Bredesen directly. In fact, he's the president of the board in this clinic, and it's only a 2-hour drive from me. So I've been under treatment with her for about 9 months. I had already been on the diet, the food plan, and the sleeping plan, and the exercise plan, and I lost 110 pounds. And that in itself cleared up a whole lot of metabolic issues that are also insults that cause cognitive decline. But the testing that they were able to do narrowed down my biggest issues to be a mold and yeast toxin, as well as the vascular things that were very obvious. Everybody knew, but a lot of those had been addressed through my cardiologist. And in treating those, I'm also in a clinical study that is just data. So about every 4 months, I go in and do testing. Every time I turn around, I'm getting better and better just from following the protocol. And it's called the Apollo protocol. You can find them under apollohealth.com. So that, and the other thing I have to say, because it's also been the biggest thing, was support groups through National Council of Dementia Minds. Seth mentioned that. Great organization. Can't say enough about it.
Great. Okay, thank you. Seth, go ahead.
In addition, I had forgotten that early in my journey, I came across a book that was excellent. I'm showing you it. Okay. It's called What If It's Not Alzheimer's? A Caregiver's Guide to Dementia, edited by Darry Radin and Lisa Radin. So it goes over several different types of dementia. So you have some information about each category, and it just gives you a little basic information that really helped also reassure me, because it gave me more insight.
Seth, were there any healthcare or service providers? So thinking of providers outside of really the healthcare arena, but maybe community services or other types of services that played a key role in your kind of early journey and as you continue this journey, and what would make a particular service provider, if you think of someone that was particularly helpful, made them either helpful or perhaps not helpful along your journey. So just thinking of kind of encounters with healthcare or other service providers. And I think of service providers really broadly, helping you with setting up care or helping with things around the house, whatever it might be.
No, not specifically. I think that one thing that helped me with my journey was my attitude. I not only was involved with the delivery of several thousand babies, but I also taught for several medical schools. And I wanted to, even though I wasn't able to see patients or deal with patients directly, I wanted to continue helping others. So I went out of my way to try to educate others, give them support, give them advice, give them direction. Part of that was being written about, a full large article by the Wall Street Journal. I've been interviewed on TV several times. I was invited, and they flew me out to speak at the National Institute of Health. And I encouraged to improve funding for research for different types of dementia. And I've been invited to speak at several national conferences regarding dementia as well as FTD. So being participating in these different types of groups has helped make me stronger as an individual. The fact that Bruce Willis came out about his FTD and I was diagnosed about the same time. And after I saw that his family came out, I decided to come out. And that's when all this essentially pursued. I think one of the things that really motivated me was this unfortunate occurrence with Bruce Willis, that he has the same condition that I have.
Okay. We often hear from people, they'll say the People magazine for dementia or something along the line, where you say FTD and someone thinks of Bruce Willis, or they say a different condition. And it is oftentimes those kind of celebrities that bring a condition to the forefront.
And I also just want to suggest that if people are on this journey where either in the very beginning or more advanced, if they're not exactly sure what's going on, make sure you have someone supportive that goes with you to the doctor's appointments or is aware of what's going on, and try to keep a journey. I kept on being tested over and over again for 5 years before they came to a diagnosis. And then they said, how long has this been going on? And I said, at least several years. And they said, is there any way to prove it? Okay, I kept a diary, and they looked at my diary, and the diary went back in 2017, and I kept track of things that were atypical for me. And they said, this has been going on for years. So even though I scored very high on my cognitive tests, they said, no, this has been going on. And on one hand, like I took a 5 and I repeated a 6-hour cognitive test, and they said, the good thing is you scored very high, maybe because you were being involved with taking care of high-risk obstetrics and you were doing advanced robotic surgery, and that's why you were scoring so well. But overall, the findings were consistent with that of FTD. So definitely keeping a diary, having someone to be supportive of you is helpful.
And Miriam, based on your experience in thinking about your first year after diagnosis, what specific resources and tools do you think should be made available to every person who's newly diagnosed with some type of dementia?
As I said before, a care manager from the beginning, not mid-stage, not end stage, someone who you are connected with right from the beginning, because we have the data and the information that shows that dementia is a progressive disease. And so that support will become more and more critical, but it doesn't make it unnecessary from the beginning. So that will be the one I would probably stress the most. I do believe there's a lot of reform that needs to happen surrounding insurance, what's covered and when along this journey. There's so much that is not covered from the beginning. And so as we advocate, those of us with dementia and our care partners and families and folks like you who do this awesome podcast and work in your fields, we have to draw attention to the fact that people are living longer. Dementia isn't just a disease for older people, as people once believed. In fact, there are people who are very young. Even I was diagnosed at 54. I was 54 years old. With the younger onset dementia comes a huge shift, because I had to stop working. I had to close my business. That turns the finances of the household upside down. It's just a number of things that come into play. And so a person with dementia who seems to not need the level of support from the very beginning does in fact need that support.
Great. Go ahead, Seth.
Yeah, also a suggestion, early in your search to find out what you have, if you truly believe that you have something, stick with it. If one physician doesn't necessarily give you the answers that you truly believe that is going on, then search out other opinions. In New York, I went to 4 doctors, and they all agreed. Not 2 of them nationally known specialists. But early on, also, when I'm encouraging, even before you get a diagnosis, I would recommend to go out and make sure you get proper insurance, medical insurance, life insurance, and especially long-term care insurance. Because once you get a diagnosis, you will not be able to get this type of insurance that's necessary. You're like, you have this disease, it's too bad, it's too late. So before you undergo genetic testing, for example, get these different insurances. And because, like I said, you need to protect yourself as well as your family.
Sure. Go ahead, Phyllis.
I totally agree with what Seth said about be relentless for diagnosis. However, the one caveat I want to throw out is the more the medical community learns about the disease, the less likely they are, the less comfortable, I guess, they are about coming up with a definitive diagnosis. My current neurologist won't even do that because there's so many causes, and he calls them insults within my system, that who knows what is really causing it or what is really the biggest problem that I have. He's comfortable just saying likely to have Alzheimer's.
Go ahead, Miriam.
Okay, just to add a little to what Phyllis just said, I'm not sure about every type of dementia, but I know that dementia with Lewy bodies cannot be confirmed as a diagnosis while you're alive. The diagnosis comes post-mortem. So I had to, even though my doctor knew or was pretty sure that was the diagnosis, he was reluctant as well to say definitively that this was dementia with Lewy bodies. And so it took a very detailed symptom history, which I kept the way that Seth did for many months, a DAT scan that was slightly abnormal. And then finally, the SIN1 skin test came along. And that was the third and final piece that test came back positive, by the way. And it was enough for my doctor to feel comfortable saying definitively that my diagnosis was dementia with Lewy bodies. That test cost me over $2,000 because it was not covered by insurance, but it was the only way that I was going to be approved for Social Security disability. It's horrific what you have to go through sometimes to get a diagnosis and then get the support that you need.
Thank you all for sharing your insights and for taking the time to join us for this podcast episode and sharing all your insights with our listeners. Thank you also for all your advocacy for others who are on this journey with dementia as part of the National Council of Dementia Minds. We're so lucky to partner with them for this series of podcast episodes. And thanks also to our listeners of this GSA Momentum Discussion Podcast. Thank you again, Seth, Miriam, and Phyllis.
Check out GSA Enrich at geron.org/enrich for engaging learning resources, including toolkits, publications, webinars, podcasts, and more.